Good evening. Today, we take a closer look at leptospirosis trends in Malaysia from 2010 to 2022. This bacterial infection saw a sharp increase after becoming a notifiable disease in 2010, with cases peaking in 2014 and deaths reaching their highest in 2015. The most affected states were Selangor, Kelantan, and Sarawak, while Perak and Labuan consistently reported the lowest cases. The case fatality rate ranged between 0.6% and 2.4%, with a concerning rise in 2020, doubling from 0.6% in 2019 to 1.3%. Trends showed a steady rise from 2010 to 2023, followed by the 2014 peak. Cases declined in 2016 to 2017, rose again in 2018 to 2019, and dropped in 2020-2021 due to COVID-19 movement restrictions. Experts believe environmental and lifestyle factors contribute to higher cases in certain states, especially flood-prone and highly urbanized areas. With fluctuating death rates, health authorities stress the importance of early detection and preventive measures. That's all for now. Stay informed and stay safe.
This is so scary. I didn't know it was this serious.
Oh, you don't know?
Yeah.
Actually, leptospirosis has actually been around Malaysia for years, mostly affecting people in high-risk jobs like farmers and also civil workers. But no one really paid much attention to it. That changed in 2010 when it officially became a notifiable disease, meaning every case had to be reported. After that, the numbers shot up, especially in 2014 because of floods and poor sanitation. And in 2015, turned out to be the deadliest year. But then, something weird happened in 2020, which the cases suddenly dropped. Why? Actually, it turns out COVID-19 and the MCO kept people indoors, so they weren't getting exposed as much. The catch is, even though there were few cases, the fatality rate actually went up.
I see. How do you know so much about this?
Yes, because I read it online. Moreover, most of the people affected were men between 20 and 60, especially in areas with poor waste management. And even though the numbers dipped during the pandemic, leptospirosis is still a huge problem, especially with right now we have the climate change and all the flooding happening.
I see. It sounds dangerous. I
Yes.
think we should stay safe.
Oh, a water fountain. Yes.
Stop! Don't do that. It may lead to leptospirosis.
Huh? I never heard of that.
Yes, it's true. It is because leptospira are spread to the urine of the infected animals. The infected animals or the primary hosts are wild animals such as rodents, which are rats and mice. You can be infected if there is any contact with the water or soil containing urine of the infected animals, especially after a heavy rainfall or flooding. Not only that, eating or drinking contaminated food or water. There are many common cases that happen in Malaysia involving leptospirosis, which they got infected after doing water recreation activities at the waterfall or river. This infection could not get any worse if the bacteria are exposed to any open wound or the mucous membrane. The bacteria will get into the body through it and they travel through the blood to other organs. As a result, leptospirosis can cause organ failure or even death. However, because it is a zoonotic infection, it's rare for people to spread leptospirosis to other people.
Okay, I won't do it.
Great!
Why would I listen to her? I should drink though. See? Nothing happened. Can I come in?
Yes, come in. Sit down.
Thank you. Doctor, I'm feeling unwell today, doctor.
Can you tell me the symptoms you are having?
I have a few symptoms, such as fever, headache, sore muscles and rashes.
These symptoms are a bit too common for me to diagnose. So I want to ask you if you did some water activity recently.
Let me think, doctor. See, nothing happened. I think yes, doctor. About 2 weeks ago, I do water activities.
I think this could be leptospirosis. Do you want me to explain more about it?
Yes, please.
Leptospirosis consists of two phases. The first one is the leptospiromate phase, and the second one is the immune phase. You may experience mild symptoms or no symptoms in the leptospiromate phase. Some people develop severe symptoms in the immune phase. This is called Well syndrome. It can include kidney failure, jaundice, yellow and coloration of the skin and eyeballs. Other complications including magnetis, inflammation of the lining of the brain and spinal cord, can also occur. Most people who develop severe disease require hospitalization, and severe leptospirosis can sometimes be fatal. Symptoms usually develop after 5 to 2 weeks following infection and last from a few days to 3 weeks or longer. Same with what Arif is experiencing after 2 weeks of contact with water. So Arif, I will suggest a few treatments for you to undergo and help you recover. And we'll see a few days to see the result.
3 weeks later.
Arif, hi!
Hi.
It's so nice to see you here. I heard that you've just recovered from leptospirosis disease. How are you feeling today?
I'm feeling sick in the past few days, but now I'm feeling much better. Since the doctor suggests me a few treatments,
Oh, that's good to hear. What are the treatments that the doctor suggests you to do?
it's a bit long. Should we take a walk?
Yeah, sure.
Leptospirosis is a serious bacterial infection that requires quick treatment. If caught early, a simple antibiotic like doxycycline can help, but severe cases need stronger medication like benzylpenicillin or cetirizine. Some patients may experience a sudden reaction called the Hersheimer response, leading to the fever, chills, and low blood pressure as the bacteria die off rapidly. If the infection worsen, it can cause life-threatening complications like lung bleeding, kidney failure, or shock. In such cases, immediate hospitalization is essential. Treatment may include IV fluids, medication to stabilize blood pressure, breathing support, dialysis, and managing heart or blood clotting issues. While corticosteroids might seem helpful, but they aren't recommended due to the unclear benefits and a higher risk of infections.
Wow, that's a lot to do. So we should know the precaution as an early prevention, right?
For sure. Let's watch a video over there.
Yeah, let's go.
As awareness to all Malaysians, we should prevent or lower our risk of getting leptospirosis, which is better than cure. First, we should not swim or wade in water that might be contaminated with animal urine, especially after hurricanes, floods, or heavy rainfall. Second, always stir and cover out cuts or scratches with waterproof bandages. Thirdly, we should wear waterproof protecting clothing, shoes or boots near flat water or other water or soil that may be contaminated with animal urine. If we take part in water recreation activities like swimming, boating, fishing and adventure racing, we need to do a research about the location, if there are any history about a leptospirosis infection for the area, because we will be in the water to do a recreation. Most importantly is always wash our hands frequently.